We want to welcome you to Q&A with Doctors A and J, brought to you by Alterman and Johnson, Family Chiropractors.
Hello and welcome. I'm Dr. Johnson with Alterman and Johnson Family Chiropractors, and you're joining us for Q&A with Doctors A and J. And in this series, we are bringing in some local experts to contribute what they can, the resources that they have that are in line with what we do in the chiropractic lifestyle. So right now I'm here with Sharon Schmidt, and Sharon is the owner of Fruitful by Midwifery. Hi, Sharon.
Hello.
Thanks for being here.
I appreciate the invitation.
Glad you're here. So we're going to get this off to a start with something a little fun.
Bring it on.
Tell us something about yourself that not many people know.
Oh, besides all the things I do, well, not many people know, I guess some people know, but not many people know that I'm a pilot. And I started flying airplanes when I worked for an eye doctor, and I was deathly afraid of flying. And we had an office in Green Cove Springs, and we would fly there from Craig Field. I thought I was going to die every day I went to work, which was kind of what pushed me into learning how to fly, was conquering that fear, which for me at the time was kind of a big deal, being able to face my fears. So next thing you know, I'm not only conquered my fear, but I'm like, how do I do this for myself? I want to fly by myself. I want to be in that left seat. So it was a really good experience for me, building my confidence. I think we all need something that challenges us like that. But yeah, that's something about me.
Well, talk about stepping into your fears and conquering them. That's a pretty big one. You know,
Yeah, it is.
I don't know, afraid to walk outside to my car at night, or talking about being up in the sky.
Right,
That's pretty awesome. So what do you fly? Not that it means anything to me, but it might to somebody else.
You know, yeah, I got my single engine land, and that's as far as I went. Had you know, just not a lot of time to do it in the last decade, but you know, it was kind of like I got to do that. I checked my box, you know. So
yeah. All right, well, thanks for sharing that with us.
Yeah.
And so there's not been a lot of time for that in the last decade, and I would guess that in the last few weeks you're having less time than ever because of everything that's going on around us. And
yeah.
so one thing that I wanted you to just talk about and share with us is just how that's impacting things. And I know that I'm hearing from moms that I work with that have planned a hospital birth that they're not so sure that's what they want, and they're reconsidering their options. So what are you seeing? What are you hearing from those moms? And then also along those lines, what are the considerations for the moms, and what are the considerations on your end in terms of accepting a mom who wants to transfer care?
Sure, those are great questions. I think the most important part of that is recognizing that this is new territory for all of us. I'm sure, you know, everybody who's watching this is being challenged by this pandemic in different ways. We talked earlier before the interview, whether, you know, how some of us are more, you know, fearful. That was me with the flying, but you know, it's interesting that I'm going through this in a very non-fearful way, because that's the way that I operate. But I do see that some people are coming into it afraid. And I think that's the first thing I want to do, is make sure, however I can, that you know, that I can help eliminate some fear for many of these families that are coming to us, who are already with us, ones who are calling us. And one of those ways is just to keep a watchful eye on, you know, the CDC, and watching the trend for our area in particular, looking at the recommendations and implementing them into our private practice. As far as being contacted by people who are now wondering if the hospital is a safe place for them, most of the initial motivation seems to have been because they are restricting who can be with them in labor. Fortunately, I'm seeing some of the hospitals now backing off a little bit and saying, okay, your doula is important. And I'm like, yes, very important. But they're starting to recognize that, you know, it is important to keep as much of the birth team intact, you know, and together. The other component to that is women are contacting us now is it's that hospital setting. It's not just about who can be with them and who can't be with them. It also is, you know, in the hospital, what, you know, what are the people in there for? You know, the next floor, are they COVID patients, or, you know, is this a breeding ground for this virus? And of course, you and I know all the precautions are being taken. It's not an unsafe place to be. They're doing what we're doing. They're doing all the things to keep it safe for the patients there and the faculty, the people who are working there. So that kind of segues into, you know, us getting the phone calls, triaging these patients and making sure that they're a good fit for us, that their motivation for, you know, deciding that they're going to deliver in a different venue really go, you know, that they really understand what we have to offer them versus what the hospital has to offer them. And fortunately, the majority of the women who are contacting us are good candidates for out-of-hospital birth. They're low-risk, healthy young women who, you know, just want to feel safe when they're having their babies or baby, you know. So
yeah, so you brought up a couple of points that I just wanted to come back to. The first one was, I love that you said this, that wanting to support moms in making educated decisions, but not based on fear.
Right.
Right? Because decisions made on fear are often not good decisions.
No.
So I think that's great advice. And then what the last thing that you were saying, oh, I lost. Maybe
say rewind that tape.
I'll rewind it later. Maybe it'll come back to me. Just some really good and valid points. So, oh, I know what it was. So women are contacting you in different stages in pregnancy. There has to be a point at which, well, I don't know, a point at which you don't recommend making the transition, or does that really just vary from one person to another?
Yeah, it really does. It's very individual. There are circumstances where in practice, and yeah, I've been practicing as a midwife since '94, that women, you know, find out about the practice or find out about me and our midwives and call on a Tuesday and have their baby on a Saturday. That actually happened in the beginning of my practice. But, you know, it was the best birth, not just for her, but for me. It was something that I needed. And, you know, it's hard to say who that person's going to be, you know, because a lot of people will have, you know, their full charts, they're healthy, you know, they're making the decision, maybe initially on fear, but then it evolves into, no, at first I didn't want to be in the environment I'm in. I've done my research, and then in a very short time, this person has gone from, you know, their fear motivation to educated decision. And I listen to them, and particularly those women are, you know, great candidates for an out-of-hospital birth.
Right.
I think one of the things that, and it's for everything, that never let fear make your decision for you, because fear will steer you wrong every time. It really will.
I think that's a great point, great advice.
Yeah, you know, even simple things like if somebody doesn't want to vaccinate their child, do your research. you know? If it's because you're afraid of your child having a needle, that's not a good reason. That's fear. If it's you're afraid of anything going wrong, get your information straight. And then when you can make an educated decision on a topic, especially parenting, you know, let's face it, there's a lot of decisions that get made over those many years of parenting.
Yeah.
Actually, I don't think it ever really stops, does it? Now, people say 18 years old, but it doesn't.
Yeah.
But anyway, you know,
My
so.
oldest is 30, so I'm still, yeah.
See?
So I want to come back again to something that you said.
Yeah.
So you brought up what's going on with the hospitals.
Yes.
Support people, doulas, and you would know more than I would about this, but I'm hearing that some hospitals are allowing, and then some of those have also changed their minds. And what does that look like for you in a home birth or the birthing center?
Right. Yeah, thanks for mentioning that, because I'm not sure a lot of people know, we do have the only licensed birth center in Jacksonville. And we've been licensed since 2005, so it's a good thing for our community. But no, I think for us, I don't know that it's really ever changed. I think we're highlighting things that are pretty logical, but in light of COVID-19, we're suggesting that if you're coming into the birth center, or even in a home birth setting, if there are people who are just going to be there, that maybe they can wait at home. In other words, just waiting in the family room here at the birth center, you know, not being involved in the birth process itself, it might be better for everybody, including your guests, just to be at home, and then you can make an arrangement after the baby comes to visit the baby on your standards of how you're dealing with COVID. But for us, it would be the standard, nobody with a fever, including the care provider and her team. Nobody who's been exposed to COVID in that 14-day period. And we're continue to say traveled out of the country. I think that one's pretty nipped in the bud right now for most of the people getting ready to have a baby. You know, they haven't been going anywhere, but and we're certainly not going anywhere. So so doulas, birth photographers, your sister, your mom, you know, the people that you lean on for support, that I think it's important that they're in that birth environment as long as everybody's healthy. Okay,
so proper screening measures, but then mom is supported by pretty much who she wants to be supported by.
Yeah.
That's awesome. So you have the birthing center, and you also attend home births.
Yes, ma'am.
And there are 3 of you at Fruitful.
That's correct.
Okay. What are they by name?
Yeah. So we have Tara Detra. She's a midwife in St. Augustine. I've known Tara for a long time. I was actually her midwife for all of her Florida babies, we'll say that. And she trained under me. I should have looked it up before the interview, but she's been practicing over a decade. And then Serena Burr, who's a midwife in Flagler County, and she's been working with us for about a year now. Yeah, great women, great midwives, good work ethic, just good people.
Okay, so of course I know that they are. If you've chosen them or they've chosen you, they must be good. So current day, you're still taking new patients. You still can accommodate people that are looking to make that switch.
Yeah, and I think it's important, you know, that we make ourselves available during this time. It's part of what midwives do. I think being a little bit different and not the mainstream medical community, it's just so much different. It's about relationship. It's about getting to know people, and that's been the challenge, accepting people later, you know.
Can we talk about that? Because
I'd love to.
I know that the schedule of in-office appointments might be different. So talk to us about how that's looking and how you're continuing to build those relationships and stay connected with moms.
Yeah, yeah. So what we're doing right now, and it's interesting because it does evolve weekly over the last couple of weeks, 3 or 4 weeks now, where we have now implemented Doxy, very similar to the Zoom format, but it still lines up with HIPAA, so we're able to protect the patient and their information. What we do is the majority of the talking part of the visits are done by video chat. Telehealth is also known as. But there is a component that's so important in the midwifery model, and that does involve feeling the position of the baby, listening to their baby, blood pressure, temperature, making sure that mom is healthy. So what we've done here, and we're pretty lucky to have a facility that allows us to do this. We have shaded parking. We have the patients pull up into the shaded parking area, a video chat with them for as long as they need, answering questions, and just being able to visually connect with each other, I think, is really important. So that's the component we use, is that video telehealth. And then afterwards, we mask up, glove up, go outside and listen to babies and measure bellies and do blood pressure and temperature. And I think it's important to note, you know, all these things that we're doing are evolving, and I don't know what it's going to look like next week, but I think we've got it to a pretty solid place now where everybody feels protected, and I think that everybody's satisfied with the connection we're getting during this time. You know,
So
no hugs though, Diane. No hugs.
I know we're all
hard.
missing our hugs. I know, but what a creative solution you have come up with, that you're doing the telehealth while they're in the parking lot, and then you're going to them rather than having them come into the office. I haven't heard of that one. So
yeah, and I think what's helpful, I have to give a shout out though. A friend of mine, she's a midwife in Sanford, Michelle. She's a great midwife. Her and I went to school together, but her and I were talking a couple of weeks ago about, you know, how this was going to challenge our practices, and she put that thought in my head. So it wasn't, you know, it's definitely originated from a friend of mine. So
other people might get, you know, get an idea from you sharing this now.
Good.
So.
I would love that.
Yeah,
that's great.
So before we wind down, is there anything else that you want to share? Anything else that you want our community to know or hear about what's going on with you and midwifery and birth?
Yeah, I think we're blessed in our community to have so many wonderful midwives and so many options now. It's not always been that way, and I've worked hard training a lot of these women up, and I'm so grateful that we have the options that we have. And just watching all the other practices, and I say all the other practices, I don't watch all the other practices, but you know, the midwives I'm close to for sure, and how they are approaching this pandemic and what they're doing. It just makes me proud to be a midwife in this community, and, you know, to have done it for 26 years now as a midwife in Jacksonville. Makes me proud of the baby midwives. They're not baby midwives, but, you know.
Well, and our community is so blessed to have had you here for as long as you've been here, and we're really grateful for everything that you offer.
Thanks.
All right.
Same to you guys.
Oh, thanks, Sharon.
Absolutely.
We are going to post your links to your Facebook page, to your website. We'll post those with this post, so people will be able to find you and reach out to you if they want to.
I think that's wonderful. Thank you so much.
Oh, thank you. It's been really fun.
Yes.
All right, Sharon.
Right. Bye-bye.
Bye.